Thank you for the great talk. And then Jeff Niederdeppe from Cornell.
All right. I'm standing between you and lunch, I guess a discussion as well. So I was asked to talk to you today, if I could figure out how to work the clicker. Maybe it'll be even faster. That's that. Oh, the big arrow, as it turns out. I was asked to talk to you today about some lessons that have been learned from tobacco control. And I'm going to draw on both my own experience working on various projects in tobacco control over the last 15 years, as well as some systematic reviews and meta-analyses of the available literature. And I'm going to seek to answer two questions. What do we know from tobacco control about the factors that help determine the success or failure of public communication campaigns targeting individual behaviors, in this case, smoking? And briefly, I'll comment on what impact can health risk messages have on broader support for policies or funding or other factors that might also contribute to efforts to remedy those threats. So I'm going to make 4 points in response to this question. When do health risk campaigns work? And the first thing I'm going to argue is they work when they focus on behaviors and their context, not necessarily the risks per se. Let me give you an example. So why do we care about smoking? We care about smoking because it kills lots and lots of people. That doesn't necessarily mean the most effective way to prevent people from smoking or to promote people to quit smoking is to tell them about the health risks of smoking. So let me illustrate this with an example that I've worked on over the years related to youth smoking. So what I'm showing you here is a relatively complicated table that I don't expect you to understand in an amount of time. But what I want to point out is this comes from data collected around the Florida Truth Campaign, which was one of the first youth smoking prevention campaigns that were really, really well funded in the late 1990s. And the researchers behind this campaign looked at a variety of factors and tried to understand what predicts whether or not a young person smoked in the past 30 days. And we looked at lots of different kinds of beliefs. Well, here are those beliefs about the physical effects of smoking. Again, the physical health risks, the reason we care about smoking. Not a one of them significantly predicted whether or not a person smoked in the past 30 days. What really mattered to young people was beliefs about cigarette companies, that cigarette companies are lying to them, that cigarette companies are trying to get people to start smoking. Those are the beliefs that predicted whether or not a person smoked in the past 30 days. So armed with that, the National Truth Campaign, which evolved out of the Florida Truth Campaign, developed a logic model that started with the premise that we want to affect smoking status, but didn't start with the premise that the way to do this is to tell people that smoking is bad and really harmful. They started with the premise that these beliefs about the industry, about cigarette companies, are going to influence people's overall attitude toward these companies, which in turn is going to make young people less receptive to their marketing practices, going to make them want to assert their independence as part of a sort of developmental freedom from these big, powerful industries trying to manipulate them. And so, did it work? Well, this is evaluation data from the National Truth Campaign. Again, the first nationally funded youth smoking prevention campaign. And what I'm showing you here on the y-axis is the odds of smoking. You want those to be lower. And on the x-axis, we have basically the dose of the Truth Campaign. This equates to approximately 100 average exposures to young people over a couple year period of time. And what we see, both in the first year of the campaign, the second year of the campaign, and the third year of the campaign, and kind of cumulatively, that youth living in markets that had higher levels of exposure to this campaign, not targeting explicitly the health risks of tobacco, but the fact that the tobacco companies are out to get young people, trying to get them to smoke, reduced the odds of smoking. And this is, again, controlling for a wide variety of other factors that we know reduce smoking. It's not just a simple correlation, a well-evaluated, well-designed study. So, again, the point is you don't necessarily have to start with the premise that health risk beliefs are going to be the most effective communication strategy. What else do we know? Well, we know that campaigns are successful when they achieve frequent and widespread exposure for many sources of information over an extended period of time. And so systematic reviews suggest, at a minimum, to be effective at promoting smoking cessation, campaigns need to average about 4 exposures a month. and effects increase up to about 10 or more. We also know that when the campaign goes away, so do the effects. Unfortunately, campaigns don't work like a vaccine where the body develops this immunity. In fact, quite the opposite. So we did some work, again, back on the Florida Truth campaign. Campaign launched right here in May 1998. The evaluators at the time had done a baseline survey and a series of repeated cross-sectional surveys over time. And what they were able to show in the first year of the campaign is a pretty steady increase in an index of beliefs that were targeted by the campaign. And again, these beliefs were associated with whether or not a youth planned to smoke. Well, about a year into the campaign, the Florida legislature, in their infinite wisdom, upon evidence that this was working, cut funding for the program in half, from $70 million to about $38 million. And what we were able to do is model first what happened to those campaign targeted beliefs when the campaign went from 70 million down to 38 million. And we were able to model, based on everything we learned about what predicted these beliefs in these earlier surveys, what that likely would have looked like in the absence of budget cuts. Now, luckily, the National Truth Campaign came in, formed in sort of response to this effective campaign, and launched here in around December 1999. So they had a little boost from an external source. But what we see is that campaign targeted beliefs pretty much right after the budget cuts stopped going up. And we predict that in the absence of those cuts, even without the Truth Campaign, they would have continued to rise. And with the National Truth Campaign, they would have been even stronger over time. Then we look at intentions to avoid smoking. This is young people who say, I would definitely not smoke a cigarette if somebody gave me one. I don't have any plans of doing this. I'm staunchly anti-tobacco. In the first couple of waves of the survey, we see a steady increase by about 10 percentage points, which in my world of behavior change communication is quite large. See the budget cuts, and we saw, that continued upward a little bit, but again, after about 6 months of that money being gone, those intentions started to decline significantly. And so these gains started to erase once this campaign was cut in funding. So again, it's not a pill. Communication is not a pill. You don't give it to people and then they're immediately taken care of for life. It needs repeated exposure from multiple sources over time. What else do we know? Well, systematic reviews tell us that tobacco communication campaigns work better when the environment supports the behavior being advocated in the message. So a campaign is going to work better if there are higher taxes on smoking. Campaign is going to work better if there are indoor smoking bans. Campaign is going to work better if there are restrictions on cigarette marketing. One of the major factors that seems to matter is having resources to help smokers quit. If you develop campaigns and send everyone to a quit line and you don't have the capacity to handle that volume of calls at the quit line, people are going to be waiting for 2-3 hours, and that's not conducive for successful behavior change communication. So the environment needs to be supportive of the messages in the campaign. And finally, I want to make the case that successful campaigns also take the socioeconomic context of the behavior into consideration in developing messages. Just about every health issue disproportionately affects the poor. Smoking is no different. Smoking rates are about 25% for people with a high school degree and no higher education, and about 7% for those with a college degree. So I've been on many consulting sort of cases where people are planning campaigns, and you got a bunch of people in a room, most of whom are college educated, and they say, when I was quitting smoking, what I really needed was resources. I wanted someone to tell me how to quit. So you see some of these campaigns, and here's an example from Wisconsin, where the tobacco cessation campaign had a series of ads really telling people how to quit. Have a quit plan, use resources. And what we did is we looked at the relationship between recall of those ads and the percentage who intended to quit smoking in the next 30 days. And we saw that there's a pretty significant, strong effect of these how to quit ads for people with a college degree. But if you look at folks with less education, the predominant population of smokers in the United States, we see either no effect or some trend toward those campaigns having unintended consequences toward reducing those intentions. So there's this debate in the tobacco control community about how much to emphasize how to quit versus why to quit. Noel presented research earlier talking about the effectiveness of these kinds of graphic warnings. There's meta-analytic research. There's well-conducted field trials suggesting that these studies, that these kinds of messaging can be effective. And what I really want to point your attention to is the difference between perceived effectiveness, and there's plenty of data to back up actual effectiveness as well, with different types of messaging by levels of education. So over here you got folks with 20 years or so of education, and our research in New York showed that, yeah, you know, why to quit ads that have these sort of graphic imagery like these tobacco warning labels, they tend to be perceived and actually translate into greater effectiveness than some other strategies, but it's not that big of a difference. But look over here at folks on the low end of the education spectrum, and we see pretty striking differences suggesting that these how to quit ads are not perceived as effective, thank you, among this population, whereas this graphic approach seems to really resonate. So the last thing I'll say is, what do we know about what impact health risk messages can also have on support for policy? Well, we know that the more news attention you give to a health risk, that the more likely there is to be legislative action to these issues related to tobacco. My own work has shown that exposure to state tobacco cessation campaigns that emphasize secondhand smoke are associated with increased support for clean indoor air laws, which again create a conducive environment for tobacco cessation. And I want to leave you with this complicated chart that I don't expect you to be able to read, but one place where I think risk communication raises some tensions is if you think about the trans-theoretical model, which says, hey, sometimes people aren't even thinking about an issue. You got these folks in here who are thinking about changing but aren't ready to do something. You got folks over here who are sort of prepared to take action that behavior produces in stages. Well, you can think about the policy enactment process, I think, in a similar way. And you know, tobacco is sort of over here in this area where we've been thinking about this for a long time. It's well funded. And so really what we need to think about is how we effectively can change behavior and promote action. But many infectious disease threats wind up in this sort of, well, it's not even on the radar yet, right? And so oftentimes the inclination is, hey, let's communicate about these really strong health risks we have. Let's get policymakers excited and focused on this issue. Let's get funding. Let's do the research. And this is important, but the challenge is that targeting policymakers is not a precise science, and the public is also reading these messages, right? So a message that might be heavily effective at moving a policymaker into saying, hey, we need to do something, may also affect the population and saying, hey, we need to do something. And in the case of something like Zika, if we don't know exactly what to do, we have this challenge where we have lots of people scared, no efficacy to do anything about it, and we have a challenge. So I'll stop there. Thank you very much.